The essential role of anesthesiology consults in trauma care, a comprehensive approach for critical patients. Welcome to today's episode, where we delve into the indispensable role of anesthesiology consults in the management of trauma patients. Trauma care extends far beyond the operating room, and the involvement of an anesthesiologist is crucial at every step of the patient's journey. Let's explore how anesthesiology consults transform trauma care, from the initial emergency response through to critical care in the intensive care unit, preoperative and resuscitation phase. When a trauma patient arrives in the emergency department or trauma bay, an anesthesiology consult becomes vital. The first priority is airway management and advanced resuscitation. The anesthesiologist steps in to provide definitive airway control, especially in situations where the patient is not breathing adequately, cannot maintain oxygen levels, or is unable to protect their own airway due to a decreased level of consciousness or facial injuries. They are also prepared for ventilatory failure, which means the patient is not able to expel carbon dioxide efficiently. In the case of severe hemorrhagic shock, the anesthesiologist acts quickly to secure the airway before cardiovascular collapse can occur. But their role does not stop there. They offer procedural sedation and pain relief for necessary interventions, such as the reduction of fractures or dislocations, or for imaging studies when the patient is agitated or in pain. Placement of invasive lines and tubes often requires their expertise as well. Resuscitation guidance is another area where anesthesiology shines. Establishing large-bore intravenous access or central venous access enables the rapid administration of fluids and blood products. The anesthesiologist excels in managing shock, guiding fluid therapy, and starting medications that support blood pressure. Their direction is essential during massive transfusion protocols, ensuring complications like low calcium, hypothermia, or acidosis are addressed. Advanced pain management, such as nerve blocks or titrated intravenous infusions, enhances patient comfort and respiratory function. Perioperative phase, immediate or urgent surgery. If a trauma patient requires surgical intervention, the presence of an anesthesiologist is non-negotiable. Their expertise in inducing and maintaining anesthesia in a physiologically unstable patient is unparalleled. Profound muscle relaxation is achieved for optimal surgical access, and the anesthesiologist manages the complex physiological shifts that occur during both anesthesia and surgery. Resuscitation continues in the operating room, with the anesthesia team managing large volume transfusions, correcting blood clotting issues using specialized testing, and treating hypothermia with warming devices. They also monitor and treat acid-base and electrolyte imbalances, such as those resulting from crush injuries or transfusions. Advanced monitoring is another cornerstone of their involvement. The placement of arterial lines allows for continuous blood pressure monitoring and frequent analysis of blood gases. Central venous catheters enable medication delivery, volume assessment, and monitoring of central pressures. In cases of major trauma, transesophageal echocardiography provides real-time insight into cardiac function, blood volume, and can help identify specific injuries, such as pericardial tamponade. Postoperative and critical care phase. After surgery, many trauma patients are admitted to the intensive care unit, and here, anesthesiologists often serve as intensivists. Their responsibilities include postoperative ventilatory management, deciding when and how to wean the patient from artificial ventilation or planning for extended sedation. They continue to provide hemodynamic support, manage medications that help the heart pump effectively, and treat dysfunction in organs such as the lungs, kidneys, or brain. Pain management after surgery is a critical part of recovery. The anesthesiologist may place epidural or peripheral nerve blocks to relieve pain after major procedures, and they manage patient-controlled analgesia pumps to ensure comfort. Finally, the anesthesiologist plays a key role in prognostication, especially after traumatic brain injury. They help assess neurological outcomes and facilitate discussions with families regarding ongoing and future care. Summary: why call an anesthesiologist for trauma? To summarize, a consult with an anesthesiologist is essential for trauma patients who experience airway compromise, require sedation for procedures, have difficulty with intravenous access, need urgent or emergent surgery, present with unstable vital signs, have complex pain management needs, or are expected to require critical care after surgery. The early involvement of anesthesiology is a key principle in advanced trauma life support and modern trauma systems. Their expertise not only enhances patient safety but also significantly improves outcomes. Thank you for joining us as we explored the comprehensive and critical contributions anesthesiologists make to trauma care. Stay tuned for more insights into the world of surgery. It's the Everything Surgery Podcast. Dissect the extraordinary.